Greetings, everyone. This is Richard Solomon, WCWP 88.1 FM, Brookville, New York, WCWP.org. I have an incredibly special guest today. Thank you to the Public Affairs Offices at the United States Navy. On the line with me is Captain Patrick K. Amersbach of the United States Navy. He's the commanding officer of the United States naval ship Comfort. And among his many military awards include the Defense Meritorious Service Medal, Meritorious Service Medal from the Navy and the Marine Corps, Army Commendation, Navy and Marine Corps Achievement Medal, Army Achievement Medal, various campaign unit and service awards, and of course, the gratitude of all New Yorkers. Captain, thank you for being with us today.
Thanks for having me. I really appreciate it.
Could you tell us a little bit about your ship's mission and capabilities?
Sure. So the ship's mission in New York City is to help relieve some of the pressure on the health systems by taking care of both COVID negative and COVID positive patients. The ship, as a mission, when it was designed and commissioned in 1987 as a hospital ship, was to support major combat operations by having an afloat medical asset close to the battlefield to support Navy, Marine, Army, and airmen as they were injured or sick on the battlefield. So the ship itself, 1,000 beds overall, which includes 80 ICU beds, 20 PACU beds, and the rest being intermediate care beds. And when I say intermediate care, they're bunk beds. So, the bunk bed at the bottom part of that would be used for a more seriously sick or wounded soldier, sailor, or Marine, and the top bunk would be used for those that have lesser conditions, and they would obviously have to get up there for the most part on their own. So the ship also has 12 operating rooms. It has a CT scanner. It has 4 additional radiology suites, a full complement of pharmacy, laboratory, all of the functions, biomed repair, all of the functions you would find in a regular hospital, in addition to being able to berth or to house over 1,000 of its crew members on board, including laundry and meal services for those personnel as well.
Would it be fair to say that you're the CEO of the world's largest hospital configuration?
I don't know. I don't think that would be fair. I think it would be fair to say that at least right now we are the busiest intensive care unit in the Navy and probably the entire Department of Defense based on our acuity and the number of patients that we're supporting from the city of New York that require ventilators.
Wow. Where is the ship's home port? Is it Norfolk, Virginia?
It is. It is in Norfolk. It started out when it was commissioned in 1987. It was home ported in Baltimore, Maryland for a lot of years, and less than 10 years ago switched home ports to Virginia.
And while you're in home port, what kind of training and preparation exercise do you undertake before you set on a deployment?
Sure. So that's a great question because when the ship is sitting pier side, myself and less than 100 professional Navy medical and support personnel are responsible for the readiness of the ship. Now, the Military Sea Lift Command and their professionals are responsible for the hull, the engineering aspects, the navigation, those things. We are responsible to ensure that the hospital is ready to go. So we will have quarterly meetings, drills, and training with those personnel that are assigned to the platform in the event of an activation. And then we have just-in-time training, of course, for those that when we do have to pull away in a hurry, that they are brought up to speed as quickly as possible, both from a ship's perspective and being aboard a ship, as well as a medical perspective.
Now, I know from my participation on various Navy embark programs, you really see when you're behind the scenes the training, and the incredible professionalism of all crew members. How has the training helped you prepare for the New York mission?
That's a great question. And fortunately, Navy medicine does a wonderful job of ensuring that the medical professionals that come aboard are trained for the most part prior to arrival. So that training is maintained through certifications and courses that are required on an annual basis. as well as that direct hands-on care that our providers and our nurses and our support staff are doing day-to-day in our military treatment facilities. That way, when they do come aboard the ship, that they're ready to go from a clinical perspective, and all we have to do is focus on those shipboard skills and bringing the team together to work together, because a lot of them are coming from different hospital systems.
In your preparation for coming to New York, did you have to have either special equipment or special supplies provided?
No, we did not. Now, what we had to do is expand some of our pharmacy requirements. We do have ventilators on board. We do have dialysis machines on board routinely. But because of the complexity of the patients that we were getting both from New York and New Jersey, some of the formularies associated with a standard package, if you allow me to say that, were not there. So that had to be changed a little bit. Standard package that I'm talking about would be either major combat operations, humanitarian support, or disaster response. So this is kind of like those, but a little different because of, obviously, COVID-19.
Could you walk us through the process of accepting a patient? How does that actually work? How do you know who's going to be coming, and once they arrive at the pier, what's the intake process like?
Absolutely. So we have professionals that work over the Javits Center. We call them LNOs, or liaison officers, that are in direct contact with hospitals in New York City. So they've gone out to these hospitals. They've developed contact. They actually will sit down with the healthcare team, and they will determine what patients would best fit in this environment. So we are a hospital, but it's kind of a little bit more austere presentation. Our ICUs are all open bay. The wards that I had previously mentioned are large open bay wards, so they're not private rooms and they're not isolated rooms, for example. So the providers will sit down and talk, and so it'll be a doctor-to-doctor conversation for the most part to determine what patients would be appropriate for our environment. And then transportation and the discharge process would occur at the facility that would be sending us the patient, and they would come over to us by ambulance, and we would in-process them at the pier and bring them aboard the ship.
Now, are there any special ways to actually do that physically? Because if you have people on stretchers, how do you bring them on? Especially, the ship is quite large. It's like, how many football fields long, and how tall is it? Yes, it's
over, let's say 900 feet, right around 900 feet long. So it's quite a distance to move somebody through the ship as a whole. Also, there's ramps associated with that. There's a lot of movement that you would not necessarily have to do in a traditional hospital to get the patient from the pier into the ICU environment, for example. We would transfer the patient. We have at Pier 90 here, we have a really nice setup that's well lit, air conditioned, and heated. That we bring our patients in. We will transfer them from the ambulance unit right onto a stretcher in that location, ensuring that what we have as far as treatment and equipment is transferred over appropriately and safely. Any documentation that may need to have come with that patient is also turned over, and then our transport team will bring them up to the ship to the whatever location that they're going to receive care.
In terms of daily routine, if there is a daily routine, do you have like a staff briefing in the morning or an assessment at the end of the day as to how things are going, what things need to be done? Was that ongoing?
Yeah, it's ongoing. It's both, actually. So at my level, we meet with the directors on a daily basis to go over kind of an evaluation of the day's events, as well as an evaluation of the previous day's events, and that is communicated down through the individual departments, so everybody is informed and has the same information and knowledge about what is going on or lessons learned from the previous day.
Could you expand a little bit about how everyone communicates? I mean, you have surgeons, you have pharmacists, you have all kinds of different specialists and people providing all kinds of different support to the ship itself. How is all the communication actually accomplished with so many people doing so many things in a very dynamic environment?
Yeah, it's a great question. And, it's really no different than that of a hospital in the city. So we rely on, face-to-face communications. We rely on telephone as well as email to make sure that everybody's on the same sheet of music. So we do have that ability to communicate across the entire ship, regardless of what the discipline is.
Now, in terms of acute care, what kind of acute care can you provide generally and more specifically in New York?
So when we came to New York, our initial goal was to provide hospital-to-hospital transfer care of patients that were non-COVID-19, so they didn't have the virus. So we didn't bring with us a large capacity or capability to take care of acute patients. Now, some of the other missions, if you were looking at a major combat operations, then our casualty receiving area would be full up with both ER physicians and ER nurses and all of those personnel and the equipment necessary to work that environment. Same with the disaster response, we would have a package associated to better fit that need. But we did not bring that to New York. We focused more on the medical mission, on the heavy ICU level patients that we would actually have aboard. So we plussed that up, and we kind of took away from the emergency medicine response because that was not our mission at the time.
So what kinds of patient cases are you seeing right now as we speak in New York?
Sure. So we are seeing basically anything you would see in the city minus trauma. We also don't have pediatrics or OB on board, but we have multi-system organ failure patients. We have acute respiratory distress. We have COVID-positive pneumonias. The same thing that have filled up the ICUs across the city.
How would you say the Comfort differs from a military hospital, but that's stationary, that's on land?
Sure. So not too much. There's not much of a difference. Again, with the services that we can provide, we don't have an MRI. The ship is metal. MRIs don't really do well in a metal ship. But we have a blood bank. We have, like I said, the radiology suites. We have pharmacy. We have the full spectrum of care you will find in a community hospital plus. From an OR perspective, we have a lot of subspecialists on board. From an internal medicine perspective, also a lot of subspecialists on board. So we can provide basically the same level of care that you would get in most non-medical center treatment facilities in the DoD.
What would you say are the unique challenges of this deployment as opposed to others that you've been involved in the past?
So this one differs from the other ones, both humanitarian disaster, basically just from the COVID-19 and the necessity of using PPE and following CDC guidelines and all of that to such a degree that we have not had to worry about before. Now, traditionally in many settings, the ICU and obviously in the OR, like everybody sees, they're wrapped up, they're wearing all of their PPE and their masks and all of that. But in other care environments, that is not necessarily the standard or a requirement. So here it is, and it is part of our uniform now and part of our daily activities of living is you put your mask on, you wash your hands, you socially distance, and you follow those guidelines to the best of our abilities. So that is really the biggest difference between the other missions and this one.
Is it possible to sterilize areas of the ship, especially given its big size and ventilation and everything else?
Sure it is. Just like any other part of a hospital, we would have that ability. And we will have to go through some even more stringent cleanings when we are done here to make sure that the ship is ready for its next mission as well. But You think about it, the hospital systems across the state, New Jersey, it doesn't matter, pick a state, that have to adhere to very, very strict disinfectant protocols, and we'll do the same thing.
So when you're out at sea, how does the resupply mechanism work, and how does that work here in New York? Because I'm sure you need supplies, protective equipment, pharmaceutical, resupply, all that kind of activity.
Sure. So at sea, we would rely on supplies that would meet us in port if we were pulling into a particular port. Also, a replenishment at sea, which we would actually pull up next to another military Sea Lift Command vessel, and they would offload to us, usually by helicopter, or pull right alongside to refuel. Fortunately, we're sitting here at Pier 90, and we have the ability to move trucks and supplies right up to the pier, load right aboard the ship. So that makes things very easy from a logistics perspective.
What has it been like for you to be in New York? Have you had a chance to meet any of the different people other than sort of media people like myself? Have you been meeting different other people from the services? Have you been coordinating with medical people? What's your interaction beyond the ship?
Yeah, that's a great question. I don't know what anything looks like beyond Pier 90. There are a lot of conversations and emails that go back and forth, both to the Java Center and our other services and support organizations to make sure that we continue to successfully support the people of New York and New Jersey. But unfortunately, fortunately, my job is here on the ship, and in order to maintain that bubble to the best of our ability and reduce the potential of getting a COVID-19, my job is right here aboard this very large and very capable vessel.
How is all your training, and you have an extensive resume, but how's that prepared you for today?
So, yes, that's 36 years in the making, I guess you could say. It's all about teamwork and understanding what the mission is and the goals, and working to the best of your ability within that framework and the people that you have in order to accomplish that. So the military prides itself on its ability to work as a team and to collaborate, and that's something that I think that I've learned throughout my entire career that it served me very well here today.
Well, at this point, I just definitely want to, before I ask anything else, I definitely want to thank you for your tremendous service and dedication. It's what really makes America the country that it is. I noticed that in television and movies, we always see depictions of battlefield medicine. What is it actually really like when you're actually in a real dynamic, fluid situation with lots of activity, lots of stress, lots of everything, communication issues? What is that actually like in the real world?
So, fortunately, we're not in combat here, but a lot of those lessons and the training associated with what we do on a daily basis makes things move very smoothly. That coordination, that teamwork piece are instrumental to ensure that when we receive these patients. And just a couple of weeks ago, we had 10 very critically vented patients come to us from one of the local hospitals that was having some infrastructure issues with its oxygen system. And so we took 10 patients on that were all vented and very sick very quickly. We were able to do that successfully because of teamwork and communications and everybody working to the best of their abilities to accomplish the mission. Understanding each and every one of us has a certain role in that, and being able to work in that role as part of the team makes it successful and really helps us out in that situation.
Is there anything that New Yorkers can do to help you in your efforts? Is there anything that we can do as New Yorkers, as grateful people, to help your mission?
No, thank you for that. We really appreciate the support that the people of New York and New Jersey have provided us. Again, one of the most significant moments in my entire life, military career for sure, was coming into New York Harbor and seeing the welcome by the people of New York. So there's nothing more that they can do as far as I'm concerned. We really appreciate their outpouring of support, and we'll do the best we can for them while we're here.
Is there any particular web page or place that people can look at social media to see what's going on or to learn more about what the mission of the USNS Comfort is?
There is, but what I'm going to have to do is get that information to you through our PAO. I'm sure she has a couple of links that can help people that are interested to explore a little bit more about what we're doing here.
Well, personally, I want to thank you so much, first of all, for your time. Second, I want to thank the crew for all of their incredible devotion and dedication and heroism. And I truly do look forward to the day when I can maybe come to Pier 90, salute the colors, and ask permission to come aboard. I cannot thank you enough for your time and all that you're doing. And I know that all of New York is so much appreciative of what the efforts of all these very dedicated, professional, hardworking people, including yourself, have done for us. So I thank you for that.
Thank you very much for that. We really appreciate it, and I appreciate your time.
All right, thank you.